Something I treat a lot of are knee injuries. That's one of my favorite joints of the body, if you will. I treat the breadth of injuries from overuse injuries in young athletes, such as Osgood Schlatter. I also treat meniscal injuries, cartilage injuries, ligament injuries such as ACL, MCL, and then also treat things like arthritis. For meniscal injuries, a lot of times these can be treated without surgery, but sometimes they do need surgery as well. A lot of these injuries we can treat with an arthroscopy, which is a minimally invasive knee surgery. It's usually something that's done through 2 small poke holes in the knee. You're usually on crutches for a few days and in physical therapy for a few weeks. Most folks make a full recovery after a surgery such as this. ACL injuries are also very common. This is something we usually see in folks that are in their teens, 20s, 30s. It's something which is a little bit more involved, but can be done arthroscopically or minimally invasively as well. This is something that requires folks to be on crutches for a little bit longer, usually in a brace, and it usually takes about 9 to 12 months for these patients to recover fully. I see a lot of ACL injuries. Speaking from personal experience, it's a very jarring injury. It's usually a non-contact injury with pivoting or twisting where people often feel a pop. You usually will get an MRI after this injury. You then undergo what we call an ACL reconstruction, where we take either a piece of tissue from you or from somebody else and replace your ACL that has been torn. You're usually in physical therapy for 6 to 9 months, and it usually does take 9 to 12 months in order to fully return to sport. However, most, if not everybody, is able to return to sports without any issues moving forward. Cartilage injuries can affect people of all ages, and we treat them differently depending on if they are partial cartilage injuries or full cartilage injuries. With our pediatric and adolescent patients, we would treat them differently than folks who are perhaps a little bit older. If there are full cartilage injuries that involve the bone, sometimes we'll do surgery where we take bone and cartilage from another part in the knee and put it in the place where you have that injury. Sometimes we'll use that tissue from somebody else. These surgeries can be a little bit more complicated and involve a little bit more rehabilitation and recovery. However, this is something that I see a lot of and specialize in, which makes me a good physician to treat that. In patients that are a little bit older with cartilage injuries, oftentimes we'll treat those patients with anti-inflammatories or injections. When the cartilage injuries start to become a little bit more diffuse, then we do talk about total knee replacement, which is another surgery that I do.